Have you ever been prescribed Lisinopril for high blood pressure or maybe heart failure and thought, well, the doctor said it's safe, so what's there to worry about? The truth is, while Lisinopril helps millions control their blood pressure and protect their hearts, it can also trigger serious side effects that many people don't recognize until it's too late. And here's the twist. Some of the most dangerous reactions aren't sudden. They build up quietly over weeks or even months. So if you're over 50, like many of our viewers, and you're taking Lisinopril every day, this information could protect your health and possibly your life. In this video, we're going to explore 6 side effects of Lisinopril that deserve your full attention. We'll explain how they happen, what they feel like, and most importantly, what to do if you notice them. This isn't about scaring you. It's about giving you the power to understand your medication and advocate for your health. And if you've ever felt confused by medical jargon or worried you were the only one having a strange reaction, trust me, you're not alone. We're going to break it down together, simply and clearly. So grab a cup of tea, settle in, and let's start uncovering the real story behind Lisinopril. Side effect number 1, severe cough. Imagine this. You start taking Lisinopril, and after a few weeks, you notice a dry tickle in your throat. You clear it, thinking maybe it's allergies. But then, it doesn't go away. In fact, it gets worse. You start coughing more often, especially at night. And no matter how much tea you drink or how many lozenges you suck on, the cough lingers. This isn't just annoying. It's one of the most common and overlooked side effects of Lisinopril. A persistent dry cough that doesn't come from a cold, the flu, or anything contagious. It's caused by how the medication works in your body. Remember earlier we talked about ACE inhibitors? Well, when Lisinopril blocks that enzyme, it also leads to a buildup of a substance called bradykinin. And for some people, especially older adults, this triggers a reflex in the throat that leads to coughing. It's dry, it's nagging, and it often worsens at night or when lying down. Here's where it gets tricky. Most people don't connect the dots. They assume the cough is from something else. A seasonal bug, a change in weather, maybe even acid reflux. But this cough doesn't respond to cough medicine, and it doesn't go away after a few days. It can last for weeks, even months, as long as you're on the medication. Now, this side effect isn't dangerous in the way that, say, swelling or kidney problems are. But it can be exhausting, it can interrupt your sleep, make you avoid social settings, and affect your quality of life. And in some cases, people stop exercising or going outside simply because the coughing gets too embarrassing or tiring. So what should you do if this sounds like you? First, don't stop the medication on your own. Lisinopril may be controlling your blood pressure, and suddenly stopping it can cause more harm than good. But you should absolutely bring it up with your doctor. There are many alternative medications that can lower your blood pressure without triggering this kind of cough. For example, doctors sometimes switch patients from an ACE inhibitor, like Lisinopril, to an ARB, an angiotensin receptor blocker, which has a similar benefit but without the bradykinin buildup. You don't need to suffer in silence, especially if your cough is affecting your sleep or daily comfort. Side effects are not signs of weakness. They're your body's way of saying something needs to change. And here's a bonus tip. If your doctor isn't sure whether the cough is caused by Lisinopril, they may ask you to stop it for a few weeks under supervision. If the cough disappears and comes back when the drug is restarted, that's usually a clear sign. So if you or someone you love has been coughing for weeks and no one can explain why, take a closer look at your medication list. Lisinopril may be helping your heart, but if it's irritating your lungs in the process, it's time for a new plan. Up next, we'll talk about something a bit more concerning: dizziness and fainting. It's not just about feeling lightheaded, and it might be telling you something urgent about your blood pressure. Side effect number 2, dizziness and fainting. Have you ever stood up too quickly and felt the room spin? A little bit of lightheadedness now and then might not seem like a big deal, but if you're on Lisinopril and those dizzy spells become frequent, or worse, if you've actually fainted, your body could be trying to tell you something serious. Lisinopril's main job is to lower blood pressure, but sometimes it does that job too well. For people over 50, especially those who are already on multiple medications, the result can be a sudden drop in blood pressure, what doctors call hypotension. When your blood pressure drops too low, even briefly, your brain gets less blood flow. That's what causes you to feel woozy, off balance, or even black out entirely for a few seconds. You might feel fine sitting down, but the moment you stand up, it hits. Many people chalk this up to aging or not drinking enough water. And yes, dehydration can make it worse. But if the episodes start after beginning lisinopril, or they happen more frequently while you're taking it, that's a red flag worth talking about. Now, this side effect becomes even more dangerous when it leads to falls. A split second of dizziness is all it takes to lose your balance and hit the ground. And for older adults, falls are one of the top reasons for ER visits, hip fractures, and long-term disability. So what should you be looking out for? Pay attention to how you feel when you first get out of bed in the morning. Do you have to hold on to something to steady yourself? Are you avoiding stairs or bending over because of the fear of feeling lightheaded? Have you ever had to sit down suddenly just to keep from falling? These are not just age-related issues. They may be signals that your medication dose is too high or that your body isn't adjusting well to it. The good news is there are solutions. Sometimes your doctor might lower your lisinopril dose or adjust when you take it. For example, taking it at night instead of in the morning can help stabilize your blood pressure during the day. Other times, it might be a matter of looking at the bigger picture. Are you also on a water pill or diuretic that's pulling too much fluid out of your system? Are you skipping meals or not drinking enough water? These things can compound the effects of lisinopril and tip your body into a low-pressure zone. One of the most powerful things you can do is track your symptoms. Keep a simple journal of when you feel dizzy, what you were doing, and how long it lasted. Bring this to your doctor. It gives them real data to work with and helps them make safer, more accurate decisions for your care. Lisinopril isn't a one-size-fits-all solution. If it's making you feel unstable, disoriented, or at risk of falling, it's time for a medication review. Feeling steady, confident, and safe in your movements isn't a luxury. It's a foundation for your independence and long-term well-being. Coming up next, a side effect that hides quietly in your blood work and can have dangerous consequences if it's missed. Let's talk about potassium. Side effect number 3, high potassium hyperkalemia. Now here's something most people never see coming. You're taking your medication faithfully, feeling mostly fine, but then a routine blood test reveals something unexpected. Your potassium levels are too high, and suddenly your doctor is talking about changing your meds, adjusting your diet, or even doing more tests. This isn't just a numbers game. Elevated potassium, also called hyperkalemia, is a serious side effect of lisinopril, and one that can be quietly dangerous because you might not feel anything until it's already a problem. Let's break it down. Lisinopril helps lower blood pressure by affecting a hormone system in your body called the renin-angiotensin-aldosterone system. One of the side effects of how this system is altered is a reduced ability to eliminate potassium through the kidneys. That means potassium can build up in your bloodstream, especially if your kidneys are already under strain or if you're taking other medications that affect potassium. Why does that matter? Because potassium plays a major role in how your heart beats. When your levels get too high, it can throw off the electrical signals that control your heart rhythm. In mild cases, you might feel tired, weak, or nauseous. But if potassium climbs too far, it can lead to irregular heartbeats, chest tightness, or in severe situations, a potentially life-threatening condition called cardiac arrhythmia. The scary part? It often happens silently. You won't necessarily feel it happening, which is why blood tests are so important when taking lisinopril. Your doctor will typically check your potassium levels after starting the medication, then again periodically, especially if you're older, have kidney disease, or are also taking medications like potassium-sparing diuretics or certain supplements. So what can you do? First, always follow through on lab work, even if you feel fine. Those tests could catch a serious issue before symptoms ever appear. Second, pay attention to your diet. While potassium is an essential mineral and healthy in the right amounts, eating too much high potassium food while on lisinopril could tip the balance. Foods like bananas, oranges, spinach, sweet potatoes, and avocados are all high in potassium. That doesn't mean you have to avoid them entirely, but portion control becomes important. And here's something most people don't realize. Salt substitutes often contain potassium instead of sodium. So if you've been avoiding salt for your blood pressure and switched to a heart-healthy salt alternative, you might be unknowingly increasing your potassium intake without even realizing it. If your potassium levels are too high, your doctor might lower your dose of lisinopril, recommend dietary changes, or in some cases, switch you to a different medication altogether. Remember, just because something isn't causing pain doesn't mean it isn't causing harm. High potassium is one of those silent risks that can build in the background, and understanding it gives you the power to stay ahead of it. In the next section, we'll talk about another area that lisinopril can affect quietly over time, your kidneys. And for people over 50, that's a system you definitely want to keep an eye on. Side effect number 4, kidney function changes. You might be surprised to hear this, but lisinopril is often prescribed to protect the kidneys, especially in people with diabetes or high blood pressure. So how is it possible that the same medication could sometimes cause kidney problems too? The answer lies in how delicately your kidneys balance blood flow and pressure, especially as you age. Your kidneys act as your body's natural filtration system. Every minute, they're filtering your blood, removing waste, and managing fluid and electrolyte balance. To do that properly, they rely on steady, well-regulated blood flow. Lisinopril works by relaxing blood vessels and lowering pressure, which is generally a good thing. But in certain cases, particularly in people over 50 or those who already have reduced kidney function, that lowered pressure can affect how much blood actually reaches the kidneys. And when the kidneys don't get enough blood, they can't filter waste properly. This doesn't mean lisinopril is bad for the kidneys across the board. In fact, when used correctly and monitored closely, it can slow the progression of kidney disease in many people. But for others, especially if they're dehydrated, taking NSAIDs like ibuprofen or on multiple blood pressure meds, the kidneys can start to struggle. The signs of kidney stress aren't always obvious at first. You might feel more tired than usual, have less appetite, or notice swelling in your feet or ankles. In some cases, you may urinate less often or see foamy urine, which could indicate protein leakage, another sign the kidneys are under pressure. But here's the important part. The only way to really know how your kidneys are doing is through blood and urine tests. That's why doctors often check your creatinine and eGFR levels before starting lisinopril and continue monitoring them after. If those numbers start to move in the wrong direction, it may be time to adjust your treatment. This is especially critical for people with diabetes or existing kidney conditions. If your kidney function was already borderline, even a small dip in pressure caused by lisinopril could push things further than your kidneys can handle. And in some cases, that can lead to acute kidney injury, a sudden drop in kidney function that can become serious very quickly if not caught in time. So how can you protect yourself? Stay hydrated, especially in hot weather, or if you've had an illness that caused vomiting or diarrhea. Avoid using over-the-counter pain relievers like ibuprofen or naproxen unless your doctor says it's safe. And most importantly, don't skip your lab tests. And remember, kidney damage doesn't always feel like anything at first. There's no pain, no warning signal. That's why regular monitoring is your safety net. It catches the issue before symptoms appear and gives you and your doctor time to adjust. Coming up next, we're going to explore one of the rarest but most dangerous reactions linked to lisinopril: swelling in the face, lips, or throat. It might sound like an allergic reaction, and in a way, it is. But it can become life-threatening within minutes if you don't recognize it. Side effect number 5, swelling of face or throat, angioedema. Picture this. You wake up one morning and your lips feel puffy. Maybe your tongue feels strange or your throat is tighter than usual. You assume it's allergies or maybe something you ate, but within minutes the swelling increases. You're having trouble swallowing, your voice changes, and breathing becomes more difficult. This is called angioedema, a rare but extremely serious side effect of lisinopril. And unlike other side effects we've discussed so far, this one doesn't ease in slowly. It can happen fast and without warning, even if you've been taking the medication for weeks, months, or even years with no issue. Angioedema is a kind of swelling that happens beneath the skin, usually around the lips, tongue, throat, and sometimes the eyes or face. It's not a typical allergic reaction with hives or itching. Instead, it's deep, sudden, and potentially life-threatening if the swelling blocks your airway. So what causes it? Once again, it comes down to bradykinin, the same compound involved in that persistent cough we talked about earlier. For some people, lisinopril causes bradykinin to build up too much in the body, triggering intense swelling in sensitive tissues like the throat and face. The most alarming part is that this can happen at any time, even if you've tolerated lisinopril for a while. In fact, many reported cases of angioedema occurred after months or even years of uneventful use. That's why it's so important to stay alert to changes in your body, even when everything seems stable. The early signs are usually swelling or a strange tightness in the lips, face, or tongue. You might feel like your throat is narrowing or experience hoarseness. If you ever feel like your airway is being restricted, if you can't breathe or swallow normally, it is a medical emergency. This is one of those moments where time truly matters. If you or someone near you is experiencing these symptoms, don't wait to see if it passes. Call emergency services immediately. Even if the swelling seems to stop on its own, you still need to be evaluated. After an episode of angioedema, lisinopril is almost always discontinued. Doctors will typically never prescribe it again because the risk of recurrence is too high. Fortunately, there are other medications that can help manage blood pressure without this risk. And here's something you may not know. People of African descent are more likely to experience angioedema from lisinopril than other groups. That makes awareness even more critical if you or a loved one is in that demographic. This side effect may be rare, but because of its severity, it's one of the most important to know about. It's not something to be afraid of, it's something to be prepared for. Next, we'll explore a much more subtle reaction: constant fatigue and brain fog. Many people don't even think of it as a side effect, but it can absolutely come from your medication. Side effect number 6, fatigue and mental confusion. Let's talk about something that's easy to dismiss, but quietly life-altering if left unchecked. You're waking up tired, even after a full night's sleep. Your energy dips throughout the day. And lately, you've been forgetting simple things or feeling a bit foggy, like your thoughts are swimming in slow motion. It's easy to blame this on age, stress, or poor sleep. But if you've started noticing these symptoms since beginning lisinopril, they might be connected in ways your doctor didn't warn you about. Fatigue and mental confusion aren't the most talked about side effects of lisinopril, but they're more common than most people think, especially among adults over 50. And the tricky part? These symptoms don't show up overnight. They build gradually, making them hard to trace back to the real cause. Let's start with fatigue. Lisinopril lowers your blood pressure, which can be helpful for your heart. But if that pressure drops too low, your brain and muscles may not get the oxygen and nutrients they need to stay sharp and energized. That can leave you feeling constantly drained, even when you haven't done much. You might find yourself skipping activities you used to enjoy or needing more naps just to get through the day. And often this tiredness doesn't improve with rest. It lingers, making everything feel a little heavier, a little slower. Now let's add mental confusion to the mix. Many people describe it as brain fog. You might walk into a room and forget why, or find it harder to follow conversations, remember appointments, or focus on reading. This isn't dementia, but it is real. And when lisinopril causes a drop in blood pressure that's just a bit too low for your needs, it can leave your brain slightly underpowered, making thinking feel fuzzy. Other possible causes include changes in electrolyte levels, such as sodium or potassium, which are sometimes affected by lisinopril. When these levels become imbalanced, your nervous system can be thrown off, which affects not just your mood, but your clarity and attention as well. So how can you tell if lisinopril is behind these symptoms? Pay attention to the timeline. Did this mental fog or fatigue start after your medication changed? Do you feel noticeably worse within an hour or two after taking your dose? Have others noticed changes in your energy or alertness lately? The next step is to bring this up with your doctor, even if it feels like a small issue. Fatigue and brain fog might not sound as dramatic as swelling or fainting, but they can erode your quality of life just as deeply. Sometimes the solution is as simple as adjusting your dosage or switching to a different blood pressure medication that your body tolerates better. Other times, it may involve checking your blood pressure throughout the day to see if it's dipping too low. And don't underestimate the emotional toll this can take. When your energy is low and your mind feels foggy, it's easy to feel frustrated, isolated, or even depressed. Knowing that your medication could be part of the puzzle is a powerful first step toward feeling like yourself again. In the next section, we'll pull all of this together with clear advice on what to do if any of these symptoms feel familiar to you. It's time to talk about next steps. If any of these sound familiar, don't ignore them. Track what you're experiencing, talk to your doctor, and make sure your medication is helping, not hurting. And if this video gave you clarity, comfort, or just a new perspective on your health, we'd love your support. Give this video a like, and don't forget to subscribe to MediMint, where we turn medical confusion into confidence, one topic at a time. We're here to help you stay informed, take control of your health, and feel better at every stage of life. See you in the next video, and until then, take good care.